Welcome to Sweet Life Beat Life. We hope this video helps.
You begin immediately by confirming the kit contents and expiry, because accuracy depends on intact components and reagents. Once confirmed, wash your hands thoroughly and clear a flat workspace to prevent contamination. Make sure you have a timer ready and avoid eating, drinking, or smoking for 15 minutes before swabbing to reduce false negatives. Then open the sterile swab without touching the tip and hold the tube upright. The next step is collecting the correct nasal sample, so follow my cues precisely. Now collect the specimen carefully. You insert the swab about 1/2 to 1 inch into the first nostril and rotate 5 times to pick up cells and mucus, then repeat in the other nostril for a representative sample. Once done, immerse the swab in the buffer tube and stir for 10 to 15 seconds while pressing the swab tip against the tube wall. That extracts the viral material. Make sure to cap the tube securely, remove large bubbles, and prepare to apply the correct number of drops to the test cassette. Apply the exact number of drops to the test cassette and start your timer immediately because reading time determines validity. You will read results within the stated window. A visible control line confirms a valid test, while the presence or absence of the test line determines positive or negative. If the control line fails or results look smeared, the test is invalid. Repeat with a new kit or seek a clinic test. If symptoms persist despite a negative result, make sure to retest or consult a provider.
Thanks for watching. Consider subscribing if we helped you.